This morning, some of the stories of frontline healthcare workers and the risks they are facing and the worries that are increasing as they face equipment shortages and increased cases of COVID-19 patients. I was talking just a few minutes ago about how I was going to introduce you to a woman from Toronto who has made the most heart-wrenching choice possible to protect her own family because of what she's going to be facing increasingly in the hospital where she works, the Humber River Hospital. And the reason we found out about our next guest, whom you're going to meet in just a moment, is because of this video that she posted on social media that Canadians have really been struck by. Take a look at part of it.
Making the most of what's probably our last day. Lennon and I are having his favorite breakfast, wearing the same Christmas pajamas.
This is what it looks like to have to pack up your child to keep them safe. I would have to pick him up, being possibly sick, and take care of him and hopefully not have him get it. I know that kids don't have a high rate of getting it.
With me this morning is the woman who just posted that video and told that story, Marci Halls, as I mentioned, from Humber River Hospital, a cardiovascular technologist there. It's a wonderful thing to speak to you today, Marci. Thank you for giving us some time and for sharing your story.
Thank you. Thanks for having me.
And for capturing, as you said yourself, this is what it looks like. Tell me about what you just did and what you were showing us there with that video.
Being a single mom and coming to work, it gets really hard to keep your child safe. Even for healthcare workers and frontline workers with families at home, we run the risk every time we leave our house coming back, bringing the virus back home. So for me, it just made the most sense to send my son to my parents for as long as it takes till this is all better.
So your parents now live in London, Ontario. Pause with me because we're going to pick up a little bit more from the video that you posted. This is the actual moment, Marci, when he walks away. Let's watch this together and we'll talk about it.
Everyone, he's leaving. I'm really grateful that my parents have a truck.
I'm really grateful that my parents have a truck. Everyone, he's leaving.
Everything.
What was that like, that moment, Marci?
That was, nobody prepares you for that. It was easily the hardest day of my life. It's just him and I so much, and not knowing when I'll get to physically touch him again was just devastating.
When he looks over his shoulder back at you, that's just really hard to see.
Yeah.
I'm just wondering, you were not just living that as the mom watching it, but you also captured it and you wanted to post it and share it. Why was that part of it important to you?
Social media is such a powerful platform right now, and it's just the message is for everybody that we keep hearing stay home, but there are major sacrifices being made every day by so many people on so many levels, and it just in the moment, you know, I knew that, you know, I didn't look perfect, I didn't look pretty, there's no filters, but everybody needs to see this is the reality of having to risk coming to our job every day.
Yeah, in the raw makes it all the more powerful. And as you said, you know, it's just, there is no greater sacrifice, and it shows us what people like you are contending with as you go into the hospital or the healthcare clinic or wherever you're working every single day. What are you expecting as days and weeks go on in terms of your job and how it's going to change?
And that's the tough thing. As a healthcare worker who's not a doctor or a nurse, our jobs are uncertain. We will be redeployed. We don't know what that looks like. We don't know where it's going to be, and that will change every single day. That's really scary for a lot of us. But my whole team seems to really be in this for the long haul. Whatever we're being asked to do, we know that it's really important right now.
It is vital, and we're spending a lot of time saluting your efforts. You hear when people go out on their balconies and they ding, and the noisemakers, and they applaud the healthcare workers, because everyone knows that it is vital work that you are doing. One of the things that we're talking about today, Marci, is the shortages that are starting already and that are looming increasingly for hospitals and healthcare professionals. What are you seeing in your own hospital and your own workplace in terms of any potential supply or equipment shortages?
I mean, we do know that it's there. We have been told about, what we need, what we're allowed to have each day. And I'm not sure that it's quite sunk in yet, because it's not, we're not at our worst, right? But we've been told this is your shield, guard it with your life.
You've been assigned a face shield?
Yes, today we will be assigned our face shield.
You get your face shield today, one face shield?
Yeah. Yes.
And what, it's your responsibility to keep it clean, not to lose it? Can you just tell me about that?
We're going to have to clean it. We've been instructed how. We will also be wearing masks underneath our shield, but each shield is ours to, it's our number one priority to keep it safe and to keep it clean each day.
And how often are you wearing the shield as you go about your duties in the hospital there?
They're saying for us to wear it all day. We were even told yesterday, if you need to walk down the hall, even without patients, wear your shield. We have to protect ourselves at this point. There's no rules. So all day, every day, except for maybe when you're alone and eating.
Really? Well, that gives us a really tremendous sense of that, even when you're not dealing with coronavirus patients all of the time. No wonder you were concerned about what you might be bringing home to your son, Lennon. So as tough a decision and as tough a moment that we saw, and that you captured on video, was it the right decision, Marci?
That day, I wasn't sure. And now we're at Friday. It's been day 5 without Lennon. And every day I feel stronger about my decision and that it was the right one. It's a different type of parenting. I video chat with him as much as I can, and he's doing amazing, and that helps, right?
Is in there.
I bet it does. Well, hopefully he's up really early with his grandparents, is watching his mom, who's doing amazing as well, and knows that you are well, and thinking of him. Marci, it's just a pleasure to meet you. Thank you very much for all the work that you're doing and for the time with us this morning. Really appreciate your sharing our story and really illustrating the kinds of decisions that are before our healthcare workers. Thank you, Marci.
Thank you, Heather.